I think special interests were really in control. You had the president basically defer some of the elements of the bill to satisfy the unions, for example, some that have the so-called Cadillac health plans. You had the agreement that the doc fix would come later on, which takes the bill really out of compliance with any semblance of budget neutrality. And then you have also other elements of the bill that played to certain regions or protected certain districts in the country. And so it hardly was a bill that challenged the special interests. I don't think it does. The problem with CBO estimates is they have to take Congress at its word. When we say that we're going to cut $500 billion, for example, for Medicare over 10 years, they have to assume that we'll do it. And the problem is we won't. We know that. Everyone knows that. And so this notion that we're actually going to cut the deficit with this legislation is simply wrong. We've seen in the past, for example, when Medicare was brought into being in the 60s, we had certain figures that it was supposed to cost after 30 years, and we're, I think, 7 times that number. So you have a lot of guesswork going on that basically has as its premise, promises that we make here in Congress that are rarely fulfilled. Well, most of the Tea Party movement obviously did not want the legislation to pass. It did, but it certainly, I think, had the effect of slowing it down and making maybe some of the elements of the bill were less onerous. For example, the so-called public option was no longer in the legislation. Maybe you can credit the Tea Party movement with that. Certainly the pushback from a lot of sectors of society and the economy were responsible for that being removed. So maybe improving the legislation, I use that term guardedly, maybe it was made better, but it ultimately passed. You know, I have a hard time believing that the Constitution envisions government being able to tell individuals you have to carry health insurance. Having said that, I don't like the chances of the legislation, or I'm sorry, the litigation actually striking this law down. I don't think that it will happen when you look at what has been done with the Commerce Clause of the Constitution. It seems that these lawsuits, I'm glad the states are doing it, but I can't imagine that the states will be successful in stopping it. Certainly, when you mandate that everyone has to carry health insurance, you're basically saying through the tax code, and that's who will ultimately enforce this, you're going to ensure that everyone has the kind of coverage that government is saying that you have to have. And that is a large role, a much larger role for the IRS than we currently have. So it's going to take a huge stepped up presence of the IRS to actually enforce this law. This requires a certain so-called maintenance of effort on the part of the state to enroll a certain number of individuals and then continue with them. These are things that the federal government is not going to pick up, and so it's going to lead to increased costs at just about every level of government.